the year 2020. The world watched as COVID-19, a novel coronavirus, spread like wildfire, leaving a trail of illness and death in its wake. The pandemic's scale and impact had not been witnessed in a century, not since the 1918 influenza pandemic, infamously known as the Spanish flu. This global health crisis serves as a stark reminder of humanity's vulnerability to infectious diseases, echoing a past pandemic that forever changed the world. The Spanish flu infected an estimated 500 million people, about one-third of the world's population at the time. The death toll was staggering, with estimates ranging from 50 to 100 million, making it one of the deadliest pandemics in human history. This catastrophic event rippled across the globe, leaving an indelible mark on public health, medicine, and society at large.
The 1918 influenza pandemic did not discriminate. It struck young adults, those typically most resilient to influenza, with particular ferocity, leaving families devastated and communities reeling. The virus spread rapidly, facilitated by wartime travel and troop movements, quickly overwhelming healthcare systems ill-equipped to handle the sheer number of cases. Hospitals overflowed, and medical professionals worked tirelessly, often succumbing to the virus themselves. The pandemic exposed the inadequacies of public health infrastructure and highlighted the urgent need for improved sanitation, disease surveillance, and global cooperation in the face of such threats. The world was already embroiled in the chaos of World War I when the Spanish flu emerged. The origins of the virus remain a subject of debate, but many believe it originated in the United States, spreading first among soldiers before reaching pandemic levels in Europe. The wartime conditions, crowded trenches, troop movements, and widespread malnutrition created a fertile ground for the virus to thrive and spread. Censorship, imposed by warring nations to maintain morale, hampered early reporting on the pandemic's severity. Spain, a neutral country during the war, freely reported on the outbreak, leading to the misnomer Spanish flu. This lack of transparency and coordinated global response allowed the virus to spread unchecked, exacerbating its impact.
Section 4. A swift and silent killer. The 1918 influenza virus was particularly deadly. Unlike seasonal influenza, which typically causes the most severe illness in the very young and the elderly, this strain attacked young adults, those in the prime of their lives. The virus caused a cytokine storm, an overreaction of the immune system, leading to severe lung damage and often death within days or even hours of symptom onset. Symptoms included high fever, chills, headache, muscle aches, and extreme fatigue. Many victims developed pneumonia, their lungs filling with fluid, making it difficult to breathe. The swiftness and severity of the illness, coupled with the limited medical interventions available at the time, made the 1918 influenza a truly formidable foe.
Section 5. A legacy of change. The 1918 influenza pandemic left an enduring legacy, transforming the landscape of public health, medicine, and society. The devastation wrought by the virus underscored the importance of public health infrastructure and the need for a coordinated global response to emerging infectious diseases. The pandemic spurred advances in virology, epidemiology, and vaccine development. It led to the establishment of national public health agencies and international organizations dedicated to disease surveillance and control. The development of antibiotics, although not effective against viruses, revolutionized the treatment of secondary bacterial infections, which were a major cause of death during the pandemic.
Section 6. Preparing for the next storm. The COVID-19 pandemic serves as a stark reminder that the threat of infectious diseases is ever present. The lessons learned from the 1918 influenza pandemic, the importance of public health infrastructure, global cooperation, and scientific research remain as relevant as ever. Investing in pandemic preparedness, strengthening healthcare systems, and promoting global health security are crucial to mitigating the impact of future pandemics. History has taught us that ignoring the lessons of the past can have devastating consequences. As we move forward, let us remember the legacy of the 1918 influenza pandemic, a legacy that underscores the importance of vigilance, preparedness, and collective action in the face of global health threats.